Today is Wednesday, April 13th, 2022. We are having the advisory team meeting for April. The first section of our meeting is small groups with staff members and advisory team members. In attendance for staff, we have myself, Michelle Lizey, Kay Coolman, Laura Blair Johnson, Kyle Klatt, Sean Blaney, and Sue Iverson. We have 5 small tables, and at each table there is one staff person sitting with 1 to 2 advisory team members. Each group sits together for about 10 minutes and talks about questions they have, ideas they have, concerns or issues they might want to share with that staff person. There is a note taker for each table, and they will jot down things, and we will have everyone report out if they choose to at the end of this portion. The second portion will be a segment with Maureen Nelson of United Way, who will talk with the advisory team about the idea of the hub, which is an idea that came through the advisory team and also multiple other community areas. So I'm going to pause here so you don't have to listen to 50 minutes of mumbling small group meetings, and then we will restart when the groups report out. Okay, are we good? Good. Okay. Thanks, you guys. We just have a couple minutes to finish up before the staff members leave. But, you know, and we don't have to name everything here, but I've got kind of three things here. One, are there topics, ideas, or issues that you just kind of were interesting or you want to get out here? 2, is there anything you're still thinking about when you go home or as you're walking out to your car? Is there anything you're kind of just thinking about? And are there topics or ideas you want yourself or someone else to follow up on? So, and I know people have different, we'll get more detailed notes later, but it's good to just kind of report out a little bit right after, as we're thinking about it. So, does anyone have any just ideas or topics or issues that, as you're thinking about when you talked tonight, give me at least a couple,
Do you want me to review what I have written down?
Yeah, you could just read a few things. Yeah.
Well, the Hispanic community would like maybe a speaker to come out and explain property taxes to them in an easy way for them to understand.
Okay, good. Property taxes. And we would get probably an interpreter. Probably. Yeah.
And then another one they had was, did you ever think of going vouchers, like for people who can't afford? Like when you go to the recycle center, like to get rid of junk because people get hand-me-downs, and so they get things, and then they build up because they can't afford what it costs to take them to the recycling center, so they build up. Then it makes the neighborhood look bad. And they said, did you ever think of maybe a program or something, or budgeting or somehow, where maybe you could use vouchers for those people, or come up with some kind of program, or maybe even get somebody to sponsor a donation.
Okay, good.
And then the last one was sometimes there's misinformation on Facebook and things like that because people misquote, like they'll look at the state auditor's website and then they'll say, Red Wing total revenues and total expenditures are number 1 out of 229, but they're not looking because we have a lot of federal and state grant and bonding. So what we have to do in those numbers, we have to count all of those in our revenues, and then we count all those expenses out. But the cities you're comparing us to don't have that type of activity going on. So it can make it look out of whack.
So we need to do a better job, you mean, communicating out what the true numbers are? Does that sound, am I repeating that right or not? Yeah, doing a better job of, okay. Better communication, okay. Great. Communication on, this thing is so wobbly. Okay.
I guess within that, I don't think that betters necessarily, I mean, just simply communicating because, like, I didn't know that that's how it was. And I don't want to, you have some very active people on Facebook that always have negative things to say. But if somebody who knows, I mean, I'm not going to do it because I go down that rabbit hole, but somebody from the city that says, well, wait a sec, this is why,
So you say even approaching people, answering on social media, which we don't normally do.
Or going to the person,
Figuring it
going to
out.
the person and just saying, this is why. Just we saw this is why. Maybe do it privately. This is why this is this way. So it's not a social media rabbit hole.
Maybe
But
we
reach out to the
monitor
person
better.
who's has the concern
Okay.
and help educate on like why this is why it is. And then hopefully they in turn then would go, hey, now I know why, and
Okay.
share that information.
Good. This information on social media. Okay. Thank you. Awesome, Sue. Anybody else have just some, you don't have to go through everything, but just, something you're thinking about or something you talked about? Michael?
Community gardens.
Ooh, all right.
I'm talking to like 3 people about it, and after talking with you, Mr. Sean, I was like, yes.
Okay. More of them.
Yeah.
Okay.
Adaptable.
Oh,
ADA compliant community gardens.
yes.
Well, like, we did have a garden spot for Hiawatha Valley. It was really fun, but our clients really can't, it's hard to bend down and garden.
Like wheelchair
If you have-
accessible kind of?
No, not that. We don't really have people, I don't really know that many of our clients. But the planter boxes, instead of getting down on the ground, but have the planter boxes that people could use, the raised beds.
Yeah.
Raised garden beds.
Okay.
That's great.
Excellent. Good. Alexis, do you have some? No?
Oh, come on. You have a great one.
Come on.
Yeah.
Can I say it? Well, I do know what TikTok is, and she believes that a lot of our legislators and places, people like that are going on TikTok and utilizing it. So we're going to talk, and she's going to tell me what we need to do. and help
That's
us.
TikTok queen right there.
Yeah.
No,
In all seriousness,
a lot of the younger generation is on TikTok, and that's where we get a lot of our information from. And I have people, older people even, on there, and they have senators on there, and a whole bunch of, people are just utilizing it more to get like the word out for certain things.
Yes.
So,
Awesome.
I said, it's kind of silly, but it's true.
No, that's a great idea, because I think you hit it on the nose when you said that younger generation. I think that's a great way to reach you guys.
Well, Facebook isn't it anymore.
Facebook is boring as hell.
Yeah, so a lot of people aren't on Facebook. A lot of like my friends and stuff have deleted their Facebook. It's just not an interest. But we're talking about TikTok and Twitter is the way to go.
Okay.
Good.
Michelle, I want to add a couple of things, just
Yep.
because I know we're going to talk about hiring, but I heard 2 things. There's a fear of rejection, and I'm quoting Shalaway on that one. And why, there's simple things. Why don't we have our applications in Spanish? That's a simple one. We talk about having all these different forms and everything, but we could start with something simple and advertise our openings in Spanish. And the other one, and Sarah was talking about that, well, I've got great things from everybody, but there's 17 languages being spoken at the high school. That's crazy to me, and obviously the top 2 are English and Spanish, but we have some great discussions around HR, so I'm really glad we have that time in May. We're going to focus on that, I think.
Is there something we should put by this fear of rejection? So what was
I want
one
to
more
keep that in mind,
context?
and I think that the person to talk about that would be Callaway, and why there's a fear of coming into the city and applying for a job.
Yeah, I say that because I kind of asked her, how it's going with the hiring of the minorities. She said, nobody's applying. I'm like, they're scared. to be rejected or to be given the job, actually offered the job, they didn't come to a stigma. So this has been going on. I go in to look for a job, I get it back at an MO. No, I'm not coming for that. I want to write you a check, you know. So a lot of people, they feel like, why am I wasting my time when I know this is not going to happen, you know? So education outside too, and actually encouraging people to come and apply.
Right.
What jobs are there? What are the qualifications? Everybody's welcome. Somehow we have to let our community know that we want to hire them. And we're not, you know, whatever we're going to do. I told her when I met a lady, great lady, she's looking for a job. I'm like, you'll be good at the city. She's like, oh girl, I'm not doing this. And I'm like, why? She's like, oh, they're not going to give me a job. And I'm like, you're being negative. She's like, no, I'm not being negative. Do you know anybody working there like me? I'm like, that's why you should go. But you can see this fear of rejection. You know, that's because she doesn't see anybody else, so she thinks I should not go. Yeah.
Okay, good.
And we talked about, what is, oh, sorry.
No, please.
What did we talk about? We talked about,
Your utility story was interesting.
so we talked about the school, I don't know, we talked about implementing from school, we need to start getting the kids into trade. There are kids actually who just say, I'm not going to college. So where are they going? Into McDonald's? Is that going to be their life? Can we try to set up our kids for some good foundation? Maybe we start talking about trades. We start getting them to this. I know we're getting them to the city, but can we get some interest going somehow? I mean, they're bored all the time. Anybody has a teenager? They're always bored. They don't want to do anything. They don't want to apply for a job at the city or anywhere. What can we do to jolt that, to make them interested in doing something like that?
Good.
And,
Excellent.
Something to play off of what you just said with the kids and with the younger generation and what Lexi said. You know, the younger generation is all about this technology and all this stuff. You know, I would like to see something more, obviously these, you know, the TikToks and what's that one? Snapchat and just the way, like I had to take some kids to colleges, go visit colleges last week. The whole time they were all on their phones and doing their little selfies and this, that, you know, there's like programs, like say coding programs or game design things, you know?
yeah, say that.
Because that's something like my youngest one, she loves being on her phone and her tablet. I can't stand it, but whatever. And I started talking to her more, and she's in the park as well. I started talking to her more about, you know, won't you, like with me and my cooking, I like to know what I'm cooking. All right? Now, I put her hip to coding, game coding. And she's like, you can make your own, right? I'm like, show her videos or something like the last month and a half. She just sits on her phone now and watches like game design videos and goofy, weird things like that. And now she's getting that mentality of, I can go be a game designer and play games all day and get paid for it. I guess that's a good way to kind of look at that.
Can I add something onto that?
Yeah.
So today I got the brochure for Community Ed and Rec, and I cannot believe how many programs they have for kids. One is coding games, and then they have learn how to make a drone, and I couldn't believe it. The last time I looked at the kids stuff was a couple years ago, where they had like one or two sort of wah ideas, and now I sent pictures to my son and his wife to say, hey, wouldn't the kids love to do this? So I feel like the schools kind of stepped up in that area.
And we could do some more promotion possibly at the city of getting that word out.
Michelle, is there a way in communication?
Just a second. Okay,
Is there
so
a way in communications that we could maybe offer some kind of program or internship or something that one of them would like to develop something for us on TikTok? That, because I know I brought the puppets in and all that kind of stuff, and it was like, my granddaughter will sit and do those YouTube or TikTok videos all night long, and then she's got like, I don't know how many thousands of followers, but I mean, those kids love to do that stuff.
Yeah.
behind the thing, and maybe we could offer something like that.
Okay. Good. Okay, a couple more, because I don't want to get into Maureen's time, but are there maybe one or two more things?
Housing.
Okay, housing?
Yeah, I think we talked about,
Kyle, yeah.
Kyle, he talked about a few things. I love real estate and housing and people having homes and places to live. So we kind of talked about really rezoning, looking at property, land and rezoning, and we need to get going on this. And we also talked about when we do these developments, maybe we should give the community members first priority, and maybe with incentives or with some help so they can, if they want to develop, if they're able to develop. The reason I say that is maybe there's not a lot of people who want to do it, but there may be people who can do it, and then that money, we're retaining that money here. But we're going to give somebody from California. Where is our tax dollar going? If they lived here, they'll pay it somehow. We can all enjoy it again. So I think we should look at programs on how we can empower our own developers from the community. I don't know if there's any, but I think people would raise up their hands to build up an apartment complex or something like that.
Good. Last one. Anything?
Housing came up a lot in my conversations, just the
Okay.
lack of housing and the need for different types of housing in the community.
Okay. So what I'm hoping is that staff and or team members, because we weren't able to take, if you can go through tonight, tomorrow, so that we don't forget these conversations, write them up, take a picture of them and send it to me. I will send a query out to the team members. If you have things that you just want to jot down and say, I just want to make sure we don't lose this, you guys can send me things, and then the staff members, if you can type up a short list or take a picture of your hand scratch notes, I will type it up. I'll take a picture of this, and we'll get some initial notes out to everybody, because this was, an hour and a half of your time, so we really appreciate you coming. Thank you for taking time. The staff members can leave, and we're going to have the advisory team just come here for a short conversation about the hub with the United Way. It will not be long, and Maureen will razzle and dazzle you. Thank you very much. I appreciate it. I know. Thank you guys, and please make it out a little early. Let's see. Thanks all the staff for coming.
Yeah.
For real, right? No, it's good. No, it's just
All right, well, very nice to see you.
Thank you, Laura.
Love it. All right, have a good night. Take care.
And that's part of the
Good night, Sue.
Yeah, it is great. Good people, good ideas. So it is fun. I do like it. You too. I do like it. Okay, buddy, come to the red table. We're gonna talk to Marina a little bit. Yeah. No, thanks a lot.
Yeah.
Thanks, Laura. I've got her next. Okay. All right. We will be out of here by 8, so we will not go long. I promise.
Yeah, I have to leave by 8.
Yep.
I've been up since 3:30. Yeah.
Oh my God. What?
2 kids up since 3:30. You're like by myself.
You're like Supermom.
Right.
Sleep is over.
Hey, at least we get out at 12 tomorrow. I'm really excited about that.
In each department.
You say that again?
Bilingual.
In every department?
Yeah.
Wait, I can't hear.
Bilingual in each
Oh,
department.
yes, I'm just kind of.
I mean, finances and.
I need to, like, we need to have more classes too, I think. Like for public, like, I need Spanish because I took German class.
I took German too, I don't know why.
Which was fun because I wanted to go to Germany.
Yeah, me too.
And that's my
but
ancestors.
Hey, my son is there right now.
Really?
Why do they have so much fun? From school.
I love that was the greatest trip ever.
I took 4 years of French.
My kids are.
I know.
I want my
I've
kids
never
to
been
go
to France.
Yeah. But it would be nice because there's so many
Begging
different
my children
customers
to go on
that
all
come
those
in,
trips.
and I try to help
Oh,
them. I mean,
they
they're like
Yeah,
half
they
an
won't
hour.
go on it.
And I've gotten pretty good at like understanding. So some people come and find me, and I'm like, I don't, like, we can like work it out,
Yeah.
But it's like I would. It
That
would be
would be
helpful.
Yeah, I'll speak to.
So Maureen's gonna, does everybody, we'll just go one more brief time around with our names, okay? Because Maureen's here. So Maureen, do you want to start?
I'm Maureen, in case you hadn't guessed that already. I'm the executive director of the United Way here in town.
Michelle?
I'm Corey Kaplan.
Michael Lickness Holmes.
Choloy Hantuba Walker.
Alexis DeVries.
Liz McGill.
Janet Santiago.
Well, nice to meet all of you, and thank you for sitting here through this. Like Michelle said, we were going to talk about the hub, which doesn't exist right now. We are exploring the possibilities. Liz has been a part of this with me. And what the hub is, it's not a new idea. It's in a lot of cities and towns across the country. And we have two goals for our hub here. And that is to provide resources for people on a client first, I'm not saying this right, to put the client's needs first instead of the needs of the agency who's servicing. That's the number one goal. The number two goal is to better utilize the resources that we have as nonprofits. And to explain that a little bit better, as the United Way, we give grants to a lot of nonprofits in town. So in the almost 12 years that I've been doing this job, I've seen the inner workings of a lot of nonprofits and give them money. And they're all doing excellent work. They're all wonderful people who really want to help people, but we're all kind of paying people to do the same thing. And so if we didn't have to do that, if we could join forces a little bit better, we could reallocate that funding to be better used to help to put the people first. That's the goal of the hub, and that's not what it's going to be named, and it's just what we're calling it right now. And what it is a service center where a person can come, a one-stop shop, where you don't have to. Where this comes from too is people come into the United Way looking for help, and I'm sure, Michael, you see it at Hope Coalition too, and we say, well, we can do this and this and this, but what you need is this and this and this, so you'll have to go there and there and there, and oh, you don't have a car, you'll have to walk there and there, and oh, it's 3 below or 10 below, sorry, we don't want to do that to people, and it's really hard to do that to people, but we have no other choice sometimes. We want to end that. So what I need from you, and Liz, you can't do this again.
I don't know.
Liz was at a meeting we had with service providers, so with all those agencies who provide services, answered some of the same questions. But what I need from you guys is two things. First of all, what do people need in Red Wing that they can't get, that's not being offered by anybody? What are the gaps in services?
If the person can go get rentals, I don't know, find what, if there are any vacant homes,
Housing.
housing.
It's like the elephant in every room.
Also, just
isn't
a
it?
little bit of, insurance. If I want health insurance, I don't just want to show up at the county and I don't know what they're going to ask me, and I don't want to go there because I don't know what they need. So if there could be guidelines at that place where you say, if you need insurance, this is the places you can go to. I can go on and on, but I'll toss it to her. I'll give you that to somebody else.
I don't know, I was gonna say the same thing.
I would like to know the difference between this hub and the community center.
floating around for quite a bit now.
The hub is not, well, when the meetings that I was in for community center were more activity related and youth related, and that's not what this is. This is a place where Liz is starting her opportunity center for people who are homeless to be during the day and to have a navigator help them with resources. That would be a part of this. The food shelf might be a part of this. So when you come in for one thing, you can take care of 5 things at one time, services that you need. But it's not really a place for people to come and gather. There might be meeting space for groups like this to meet. Liz has asked to have her shelter be housed there, and the volunteers come there. So it's that kind of a community.
So it's more for adults and nothing based for kids.
It's
No, well,
service-based.
that,
Like, you
yeah,
need-
Resources,
You
more
need-
resources.
Yeah.
Resources to
You need
parents so
food
we can
stamps,
have
and you
these
need,
things,
this
so we
is
can
like,
take them to the
Yeah.
activity center.
What I'm trying to get at is that I've been in this discussion where we've literally sat and talked about this exact same thing. Creating a building where all the resources are under one single roof. So that's why I'm really confused right now.
Are you just saying it could be, I mean, just thinking really big, it could be both. It could be where youth come and have all these activities. It could be the youth community center and the hub all in one.
Like, why couldn't it be like that great resource for after school programs that these kids really don't have? So it's,
school
I get it. It's
I mean,
more,
that's really,
I'm under the understanding that this is more based for adults than kids.
well, it's family services. So, go ahead,
Can I
Liz.
interject one thing?
Yeah.
So the hub, if you look at the hubs it's based out of Ohio, and then La Crosse has a really active one, Winona has an active one. There's 20 identified pathways. And it's financed by, the one in Winona is financed by Blue Cross Blue Shield. It's not grant dependent, so it's very sustainable. And so the premise on it is these 20 identified pathways, and there's everything from postpartum, there's insurance, there's food scarcity, there's all that. And those are family-based, those are individual, they're also family-based. Housing is individual or family-based. Food scarcity is family-based or individual. It's those type of things, and it's kind of twofold, multifold. But one of them is where along the pathway are people finding barriers to get food? Many families that I worked with have said the food shelf is inaccessible, the hours don't work for my hours at work, those type of things. I can only bring 2 bags home on the bus. I have my kids on the bus, those type of things, it doesn't work. So that's one thing. Not only then is that identified over and over and over, and so it gets to this point and people can't proceed further into accessing the food shelf. So then the hub works with the food shelf to say, we've surveyed 100 people and this is where the barriers are. This is a part of the pathway that they stop every time. So how can we solve that? The second part is then you use these community connectors. Hiawatha Valley has a community connector as part of the hub in Winona. There's 5 community connectors. Those community connectors aren't housed in the hub themselves. They're in the community. They basically do kind of like what I do, and it would be like, let's say somebody's referred to the hub for food insecurity. They come in, they identify where they have insecurities in the different things. It was housing, food, mental health, physical health, dental, postpartum. I can't find my child insurance because of this and this and this.
I need WIC,
Right,
yeah.
and so then these community connectors are there to either work with them within the hub or to take them to these places in the community because they might not have transportation, but a community connector can say, I can take you there. They might not be comfortable coming into the hub on their own. So that's what these community connectors then would work with the people and say, we don't have to meet in the hub. We can meet at Bay Point so your kids can play in the park. We could go meet at Hanish. We can meet wherever you're comfortable. I'll bring the resources to you, but I'll help you obtain these resources.
And they
Did
have,
you know
they
these?
have access to different resources because they are a part of the hub.
Right, and so then how the hubs are funded then is once that pathway has been identified and they reach the end of that, like they start using the food shelf or they've had housing for 30 days or they found a provider for themselves and their family members or a dentist or whatever. My oldest 2 kids are adopted. They came with dental insurance through the state. There wasn't a place in Red Wing that we could get them in. I mean, they're on our family plan, but That wasn't something that we could have ever done with them, is use the dental that came through for them through their adoption agreement. But when that pathway now is closed, then that's how the hub is reimbursed through, in Winona, for example, it's Blue Cross Blue Shield. Because the premise on that is when these 20 identified pathways are in, let's say you need resources in 7 or 8 of them, once you're established in those and you are now secure, you will be, and this is research-based, it's not just people like Marie and I saying it works, it is evidence research-based. For years and years that say, once these pathways are closed, there is less drain on the community and the community resources and health insurance like Blue Cross Blue Shield than if we kept people paying out for these type of things. It's more cost effective for Blue Cross Blue Shield to fund these type of programs and close these pathways and have people reach independence than to keep not funding those. And so that's kind of what it is, but it's multifold. It's for the agencies to identify where are we lacking, what are we doing, because we all get busy doing and we all think we're doing the best we can, and then but when you see this outside in and then it's like, okay, here's where this is being identified each time, or most of the time people are falling into this category of why they can't access this program. Whether it's ours, so
what questions then do you, that's good to know. So what questions do you have? Because I want you to be able to have time to get
Well, here are
options
the
from
gaps of what, we've heard things like, if you are homeless or living in poverty, how do you have access to laundry? How do you have access to get your mail? What are those gaps that nobody is addressing right now in the community that you are aware of?
So we'll add what Michael said, which is...
No, don't add what I said onto that. I'm cool. I'll take everything I said back.
But we are not cool.
No, don't take... How come?
No,
I'm cool, because honestly, I think that's a bunch of shit.
No.
Because all I hear is adults.
That's what I was just about to say. Are you thinking about like resources
I'm thinking
for the
about the
children?
kids.
Yeah,
Like,
These
what about-
kids are our future.
but I was going to
That's
ask.
what I was just about
I was
to
going to ask also the question, just to kind of bring this. So we're talking about United. One. When we're talking about community center, aren't we talking about the city? Which body in this community is heading that part? Is my question.
Michael knows because there is a whole bunch of organizations, right, meeting for a number of times, and it was considered maybe the Y could potentially, house that, but I mean, Michael's right, and I think half the people in here were part of those meetings to talk about it.
Yes.
So this to me is sounding like you're thinking it's a separate thing.
It is separate, which is why I backed off from that community center. It wasn't what United Way was focusing on. Do I believe there's a need for a youth center, a place for people to gather in town? Absolutely. And I would like to see that happen organically, if that's what the hub needs to become, that happens organically, because automatically we're not going to start with every service that's needed.
But is United Way capable of handling the community center? Financially?
The hub?
No, this
Or the
youth
community-
community
No.
center.
No.
See, that's what I'm thinking. So are we talking about two different things?
Yes.
Or we're trying to put this one in one?
Right now it's right now there's two separate ideas.
Okay.
It doesn't mean they won't come together.
Okay.
You'll see when I pass out this list that youth services are a part of this. They're not forgotten. We haven't forgotten children. It's about families and maintaining the family structure and making sure that the adults have the funding, the food, the basic needs to help their families. So the children are not being left out. But if the youth center or community center conversations that I was part of with you about Jefferson School, that was not what the hub is.
Okay.
The vision for the hub is at this point.
I'm sorry, I didn't know you had.
No, it's okay. is there going to be resources, sorry if you already said this, I'm tired, like I said, for like mental health, addiction?
That's the
all
next
that?
step of this.
I'm just asking, that's,
No, it's on the list here.
okay, I'm like,
Yep.
I don't know if
So
you said it or not,
do you want to
but
hand that out?
that's
Okay,
a
so this is our
definite
second
need
step.
for Red Wing, I feel like.
Absolutely,
so.
I agree with you. And
That is
Um,
a big deal.
So what this is a little bit about what other hubs around the country are offering. This is just an overall list of general services. And we want to know what we're asking people. We ask service providers, we're asking general community members. I want to hear from you guys. What if we had to start the hub tomorrow? If we had a building and a space and everyone committed to this, and we were starting tomorrow, what are the 3 services that definitely need to be there? Your top 3. Okay, so if we can pass these out. And just circle, if you have a pen, circle the top, and not in any order, 1, 2, 3. Just circle 3 that you think are absolutely crucial. Knowing that we're not only going to stop with 3.
And what is a coat closet? Is it more like clothing or?
Winter coats.
Oh,
boots,
coats. Oh,
mittens.
got it.
Yeah.
Another question, when it says energy assistance, does it mean someone to help me fill out a form to get energy assistance?
Well, and that's the
or-
other thing that came from the service providers is they want a universal form that, so you're not telling your story 15 times at every organization you stop at. That's one of the goals there is to make it easier for people to get those services.
Even if it was like a template that everyone could have their own, but if it was like autofill, like they have on web, I mean, it's so
Right.
nice when you're online and you don't have to type this every time.
Well, the neat thing about the hub and
You know.
Winona is when you come in and you register for it, then the partner agencies that are in there, it's their responsibility to get that information and no longer the consumers.
Right.
The consumer gives it.
Once.
So it's, so
But
like,
if all of them, if there was just a programmer that did a form that just said, blank organization, but they all had the same
Right.
fields, and then they just send it out, and then
Well, really what it would be is one form that you fill out the information that all of these agencies might need, and then they can access it. So you fill it out once, tell your story once, and then you'd be responsible to if it needs to be updated. But hopefully you have a navigator who's doing that with you.
but the neat thing is like mail, like if you had updated, let's say you used, the food shelf, and you used Mayo, and you used, Hope Coalition, whatever. Once you update it, then that's populated, and everybody knows.
So
it's
basically,
updated.
they do a form and then what do you call it? That's free to share your information.
Right.
A release or
Consent,
whatever.
yeah.
Yeah, consent form.
Yep, there's a standard release
Yeah.
for everybody who's involved in the hub.
Yeah.
So in theory, the hub could even be just an online.
It could
what
be,
you want.
yeah.
I mean,
not every service that's a part of the hub is going to be housed
Right.
in one building. There
So it's
are places like the Care Clinic that will be a part of the hub, but won't move there. They've
Right.
got a great setup where they are. Why would they want to do that? But talking about insurance, that's where you would go to have somebody help you with insurance. But now we can do it at the hub.
And so the county has some of this stuff too.
That's what I was
The county
wondering.
would, the county would be a partner, yep.
Yeah, because I'm thinking the county has some of this.
And some of the county offices, like WIC, would want to be on site. Not all of the county would be on site, but we would share access. So again, you don't go to the county and fill out a form, and go to Hope and fill out a form, and go to Mayo and fill out a form. Well, Mayo
Instead,
would
you
be on
could
their
spend
own, but-
8 hours there filling out forms.
Yes.
At the county?
Literally, in the little, if you go there and you fill out, she's saying resources for all these different things.
Right.
Oh my God, I sat there, I filled out 3 forms from the county. It took me literally 6 hours.
And if you could have a list ahead of time of what information you need to bring with you, so you can get it
See,
done
that
at
would
one
be
time.
easier.
Yes.
Yeah.
And how much of that was done?
Huh?
How much of that was duplicated?
Oh my God, like everything.
Yeah,
Literally
so that,
everything.
the hub eliminates that.
Yeah.
It eliminates the duplication.
Oh, does it?
Yes, because there's one,
See.
when you come in like to the one, and I have the forms at home, I didn't bring them, but there's one kind of enrollment thing, and then everybody who else uses the hub has access to that information.
That
So that way, like, let's say your phone number
is
changes,
actually really.
and you go to the hub next time, you go, oh, and they say like at mail, hey, did anything change? Oh yeah, I got a new phone. It's updated, and everybody there knows that your phone number updated. And you don't have to go and tell people 29 times that your phone number updated, because it's one time.
Okay, yeah, no, that would make things so much easier, and I think a lot of people would.
And it's the responsibility of, like, let's say that I'm in there and, you know, I'm working with somebody with homelessness. It's Hope and Harbor's responsibility to go out and get that information, and not you to tell me anymore.
Right.
Because
okay.
it's already there. So
Right.
now whatever access I need for whatever, it's my responsibility to go in and get.
See, and that would be nice, because even filling out forms for the county, and it's in the same building, you still got to fill out everything times 10. Now I got to bring in my child's birth certificate when they already had that.
And take it a
all
step
that.
further, there's lots of people who can't fill out those forms.
Right, yeah, no, for real.
You know,
Yeah.
there's a lot. And so then or they need time to, they fill it out a little bit, then they need time to go take a walk, and then they come back, and they'll have somebody to help them do that.
Right, yeah,
You
so
know, I
that's
have to tell you, my husband works at a church, and if you're getting married in that church, they ask you for your baptism, confirmation, and it's there. You did it all there. It's in their records, but you have to somehow get those and prove. It's like the craziest thing, and it's worse in government than it is in a church.
Yeah,
So I feel
that's
your
horrible.
It is, when I was going through things and needed services too, I mean, literally every time I would get like an envelope or something with, especially the county,
Oh God.
I would literally have a panic attack,
Yeah.
and it would take me like hours to even, and part of it was like some of the things were, and you know, bless them for doing a good job, but like I had mileage reimbursement for like medical because I had to get some of my care out of town. So I would fill it out, and I would get, you'd get nothing anyway. But it's like this. I calculated on Google, and it's only 29.37 tenths of a mile. So they would spend. It was like 3 cents difference or whatever. So they would spend whoever staff time. So they probably spent $70 in time and file cabinets and letters and postage to deny the 13 cents. So I'd have to fill out the form again.
Yes.
And then another time I filled it out, and she sent a different amount because, well, it's this far to your doctor's office. I'm like, no, I get my INR done at this clinic, and the other one is down another 10 miles on Lake Street.
I will tell you
And it's
that
like-
the service providers, one of the things that they said that they hated in the gaps was red tape.
Oh.
They hate it too. They don't have to deal with it as much as people who are applying do,
Oh.
but they see how inane it is to have to deal with that.
Yeah, I mean, it was. I could
And
see
if we
like
could save
I could see
that-
where people like, and I'm not that way. I can see where people would be. It's like make you suicidal because you're like trying to get this help, and it's like it's $20 that I'm asking for, and you deny it because you said I overestimated, and it's like you did not read. I gave you the exact total and the location of the doctor's office.
Well, Corey, Hiawatha there's about 500 people.
So here's the thing, though. I hate to do this, I really
And
do.
it was quick.
Because we
Oh,
start
oh my
like,
gosh.
no, I don't, but I promise that people, when they give their time. And so
really?
here's the thing, I want to make sure that Maureen hears from people, and if you want to connect, are you?
Yep.
Okay, and if you want to connect, like, if Alexis is like, Lexi says, oh my God, this is a great, and I want to talk to Maureen a little bit for like 10 minutes or something, then maybe you and I can give you, contact or
you can give
emails,
out my-
or
you can give out
maybe
my
that's what I
email.
could,
Just
okay. Do you know what I mean? So that you could have more of a
Yeah.
conversation if you want? Does that make sense? Or you can talk after the meeting, but for other people, I want to make sure that and I'm sorry if we had to start late.
No, that's okay.
Are there a couple extra questions you want to ask, or you just want people to leave
Those are the two I
that?
want you to think about, is what are the gaps that you know of, and what are the most important things that we begin putting in a hub? And just because I'm only asking you for 3, doesn't mean there'll only be 3 services there. We'll rate them all.
How do you want us to tell us the gaps? You want us just to tell you the gaps, or you want us to write them on here?
Well, I'll write them down.
Yeah,
Do you
I've
have
got
them?
here.
I mean,
Or you can write them down and
You have
give
new
them,
ones that you didn't have the other day.
or you can email Maureen directly.
For me, it's just let people
If
know.
I put-
People
yes.
Yeah, I gotta go.
people knowing about the
Sorry, I
services are
left
out there.
my little man.
Thank you.
Okay.
I left my little guy somewhere, so I.
Do I give
But
this?
quick, yeah. I got it.
Yeah, and it is, it does a little faster.
Wow. Yeah, I guess.
So,
Yeah, so thank you.
you don't have to.
What's that?
Okay, thank you. Okay, information.
Yeah, people just don't know about what programs are out there.
Oh, I know that. Like Joe was saying, insurance. I know, that's up in care clinic. There's navigators up there to help you with it. But who don't, you know, if you don't use the care clinic, how would you know that?
And even like when you go to the county, like there were programs, and I don't know what the difference is, but like I applied here and was denied everything. But in Minneapolis, I was on a waiting list in Minneapolis, and I had housing, I had food, I had whatever. But it would have meant like I was helping my dad, before he passed away. I was doing medical care for him and everything, and I was like, even like, can I get reimbursed for this because I'm doing the work? No, they'll pay someone else to do it, but you can't because you're living there. And I'm like, this doesn't make sense. You'll pay for me to move out and have my own apartment and a house and give me food, but you won't give any kind of stipend. And I'm like,
The thing with that is,
it's like,
especially with government employees, and I hate to beat up on government, but it's because some senator somewhere thought that would be a good idea to have a rule, and they convinced everybody, and so now it's a law,
I
and
know, it's like,
nobody even knows where it came from or why it
it's like mad. I know, and they can't do anything about it. And it's like they do a good job, but it's just like, oh, it's ridiculous.
But it doesn't make sense, and you wish that the politicians would do a little more research about when you make a rule, what are the repercussions gonna
I
be?
know. Of people really in need. And like, and for me, it's like, on one side of me, it sucks to have gone through this, but I'm really grateful too, because it's like, I have family support and everything. That's like, it's hell. And I'm like, if you didn't have, I was like, oh, what you do is amazing. 'Cause it's,
I don't.
but I mean, yeah, but it's so important.
I can make it tomorrow.
And even with it, it's still. So one thing I was thinking, you mentioned laundry, but like a thing that I've noticed all the time too, both from here and from like hanging out with friends in Minneapolis stuff, is when people are homeless, you can only have little portions of food and like stable food. And it's like, it's always more expensive, which it's going to be because there's more packaging, there's more work. But it's like if there was a little, like if people had an access PIN number or something, and there was like little refrigerated compartments, so that at least they'd have a week's worth of food that could be, they could go back and they could get their food or whatever, but it's not like when Hope Coalition did that before, they had one guy that was homeless, they give their $20 voucher. This guy comes in, gets his food, but he's homeless. And then, like a couple days later, he brings back this stuff. He's like, "Well, this was spoiled. Can I get another one?" It's like, "Well, no, they gave you the food, and it's. I mean, I get it, but it also teaches responsibility. It's like, it's not. It's
The food shop assumes like everybody has a place to store that these 2 bags of food when they get it home, and they don't.
Yeah.
So can't we come back twice a week and get enough for 2 days?
Yeah. Or if there was.
One of my guys only has a hot plate. He doesn't have
A microwave.
a mini fridge and a hot plate. There's a lot of the food that he can't make
Right.
because he doesn't have an oven.
And he sits on the
Or a
advisory.
microwave.
It's like a community kitchen or kitchenette where even they could make stuff and then take a cooked thing home. I mean, there's churches that could do it too.
I just take a weekend and they gave canned goods, and people don't have a can opener.
Yeah.
Thank you. Thank you. No, it was fine.
But it never occurs to people who are trying to help.
Yeah.
That's something that people don't have.
I know, which is why the ones with the tab are so valuable.
And
But
I have plenty of can openers,
Yeah.
but I love the pop
I know.
cups better.
Yes, take my little guy.
hi.
Michelle, have your form, or you left it on the table, or?
Form.
Yeah, I figured it out. Thank you.
And I think another gap is
I know.
providers not
I
knowing
know.
what each other does.
Yes.
Like you said, like I learned from the homeless shelter that the care clinic had interpreters and they did insurance and they did.
Really?
No, I thought they did medical and dental, which is fantastic.
This meeting adjourned about 5 minutes ago at 8:05. 5.